Good evening. Thank you all so much for being here. Welcome to Lakewood United Methodist Church. I'm Pastor Laura Jasley. I'm one of the pastors here, and this is Reverend Dan Bryant. He is new to the church since we last had one of these events. He started here this past July, and so we are blessed to be in ministry together. And I would say we both believe so much in being involved in the community and fighting this crisis together. And so we welcome you to this place and to this evening of hope and learning more about our community. So we're glad that you get to be a part of this, Dan.
And we're blessed as well that Lakewood United Methodist Church is a community church. I think the number of people that come in and out of the building every week, and with Pastor Laura being in here now her 11th, 12th year, she knows pretty much all of you. And so I think she's able to make linkages and networks that are just important to us as we navigate forward. So welcome. Any questions, anything that you have, talk to Pastor Laura or myself.
Thanks, Dan. And I just want to thank the city of Lakewood and Katie, thank you for all you guys do to support this and allow us to be a part of sharing this message. There is only one restroom, just a few housekeeping things. There's only one restroom on this floor, but we didn't have that for a few years. So it is right around the corner here. If you need directions, just find myself or one of the ladies in the hospitality. And then we have plenty of restrooms on the lower level and then down the hall towards the gym. Just ask if you need assistance. We are live streaming this evening. It's live streaming on our church's Facebook page, as well as our Botcast app, and it is archived and on our church's website, www.lkwdumc.org. So it's being live streamed, but it'll also be archived there. And then we're going to be getting it over to the city to put on the city's page that is all of the Project Soar page. So if you know somebody who should be here or you hear things that you want them to know, please feel free to share this video and get the word out. We have over here some remembrance candles, rocks, and a wreath that we put up when we had our service of remembrance this past fall. And we leave this up in our chapel year-round, just as a way for people, if they need a quiet space to come in that have lost a loved one, that they can come into our chapel and write the name of a loved one on a wreath or a rock and just spend some time remembering them. And so you're invited to do that this evening, as well as on the dry erase board out there. I'm just grateful that you're all here, and I'm blessed that Cindy Marks has agreed to moderate this evening. I know as her time spent on council, she was really a champion for the city in helping us fight this, especially with her role with human services and resources and all of that. So thank you so much, Cindy, for being here to help moderate this conversation. So welcome, and you will give the other instructions.
Yes, I will. So is this mic on? Yes, it is. Great. So I am Cindy Marks, and I served 4 years on Lakewood City Council, and I am so honored to be here and participate in this wonderful Heroin to Hope event, the third Heroin to Hope event here in Lakewood. And I do want to acknowledge some Lakewood officials that are here in the audience. Tony Gelsomino, who is the Director of Health and Human Services, who is a champion for SOAR and for all of us who live in Lakewood. So we're so lucky to have her serving our community. And Chief Gilman, who is our fire chief, who can really speak to these issues very personally in his effort to train his wonderful staff who deals with these issues on a daily basis. And I also want to acknowledge Councilman David Anderson, who's Councilman to Ward 1. Thanks for being here, David, to represent the city. So a couple things before I get into like the little program, I just would like to read to you from this book called Dreamland. If you are interested in knowing how the heroin epidemic started in this country, this is an incredible book to read, and it talks about how it starts right here in Ohio. And I'm hoping, I talked to Pastor Laura, and I'm hoping that I can get the author to come here to present to us in Lakewood his story about his research. But I think this little passage that I would like to read to you speaks to the city of Lakewood. It speaks to Project SOAR. It speaks to United Methodist Church and their desire to serve the community. So I am reading from the author's notes. He says, I believe more strongly than ever that the antidote to heroin is community. If you want to keep kids off heroin, make sure people in your neighborhood do things together, in public, often. Form your own dreamland and break down those barriers that keep people isolated. Don't have play dates, just go out and play. Bring people out of their private rooms, whatever forms those rooms take. We might consider living more simply. Pursuit of stuff doesn't equal happiness, as any heroin addict will tell you. People in some places I've been may emerge from the plague more compassionate, more grounded, willing to give children experience rather than things, and show them that pain is part of life and often endurable. The antidote to heroin may well be making your kids ride bikes outside with their friends and let them skin their knees. I think that speaks to Lakewood, and I'm so glad that you're all here to be part of this community. So let me get down to business. I'd like to introduce our panel, first of all. Erin Helms from the Woodrow Project, Gina Bonamino, Woodrow Project and the Peer Support Coordinator for Project Soar, Fire EMS Representative Nick Sambula, Police Representative George Rash and Matt Wintrick, Judy Welsh from the Cleveland Clinic, Lakewood Emergency Department, which I must say is a phenomenal emergency department. If you haven't used it, use it because it's amazing. Thank you. And I don't mean that I hope you don't have to use it, but if you do have to use it, it's wonderful. Katie Kurtz, the Department of Human Services and the Project Soar Coordinator. We're so lucky to have Katie here in Lakewood. She has coordinated this project and has been passionate about bringing SOAR to Lakewood. So thank you for all you do for us, Katie. And Derek Kirkin, Adams Board of Cuyahoga County. Hi, Darren. Thanks for coming. And a couple of things that I'd like to make sure that you know, that the resource room will reopen at 8 o'clock after our panel discussion. And the Naloxone training will occur here on the stage after the presentation. And Director Tony Gelsomino will be in the chapel out this door and right to the right for family support conversation. So I hope you participate in all the activities and share community after this event so we can get to know each other and be there to support each other in whatever challenges may arise in our life. So Katie, I have a question for you. Can you start by telling us what Project SOAR is and how it came to be?
So Project SOAR, SOAR stands for Supporting Opioid Addiction Recovery, and it really came to be in a truly collaborative fashion. Over the past several years, the City of Lakewood's leadership and different directors and departments have been following the numbers and data related to opioid overdoses and deaths to overdoses. So this wasn't something new that we just came to notice last year, but we really saw a significant increase in numbers from 2015 to 2016. And through our leadership with Mayor Michael Summers, our city council, our interdepartmental with first responders and human services, as well as over 50 stakeholders within the community, came together in January of 2017 and said, we have a problem with addiction in our community, but we don't have the solution. And as a city entity, we aren't a treatment provider, but we want to work together with all the different stakeholders around Lakewood and the county and region to find a solution. And we're willing to try anything, because at this point, we have nothing to lose. So through that conversation, and at the time, the Adams Board director at the time was Bill Denahan, and he was present, and the Erin Helms with the Woodrow Project was there, the Cleveland Clinic. All these different folks were around the table, and that's when we really started to think outside the box and say, how can we address this issue here in Lakewood? And that's how Project SOAR came to be, through a lot of brainstorming and finding different acronyms that work, that not everyone uses or that don't sound weird. We came up with Project SOAR, and it's truly a peer support centered project. And we looked at, through guidance through Derek with the Adams Board, through Erin, a lot of different partners, we looked at some of the best practices happening around the country and the state. Unfortunately, there aren't a lot of evidence-based practices right now because this public health crisis, we haven't had any time to really sit and research anything because of were at epidemic proportions. So we looked at some best practices happening in Coleraine Township near Cincinnati through their quick response team. Chief Gilman found an excellent program in New Hampshire called the Safe Station Model using fire stations, as well as Anchor Health in Rhode Island, who was utilizing peer support specialists within emergency rooms. So we sort of pulled all of these ideas together and say, how can we create a pilot program with our partnerships here in Lakewood? So this is a true collaborative effort. Not one entity owns Project Soar. This is truly owned by the community, and seeing what works so that other communities may adapt or pull pieces of this for their own.
Thank you, Katie. And Lakewood certainly is a front runner in Ohio in developing this program, and it couldn't have happened without Katie's initiative. And Erin, as a recovery house organization, how has being involved in Project SOAR supported your mission?
Well, thank you all for showing up tonight and everybody being able to be here hosting this wonderful event. I would say from recovery housing standpoint, we get to see people in recovery. It's after they've completed detox, after they've been in inpatient treatment, and they're starting to work in their early stages of recovery. And we're very grateful that we get to see people for long periods of time in recovery. But that has hampered me professionally a little bit, that I'm not used to working with people in those very early stages. That was a previous career of working in detox and inpatient treatment. So the best analogy I can say, or story I can share rather, is there was a woman that I had known that had overdosed, and she went to Lakewood Emergency Department, and Dr. Walsh was there, and this is prior to Project SOAR, and at 2 o'clock in the morning, I didn't know where to send her. I didn't know what to do with her. There was no places that were going to take this woman at 2 o'clock in the morning. Her coming and living at a recovery house, that wasn't an appropriate level of support. Her staying in a hospital or emergency room department wasn't the proper place for her to be, and it was, I didn't know what to do. And people countless times across the county, state, and country are feeling that. And this is a real solution. So being part of this project from the beginning, being able to see that there are many different entrance points for people to enter recovery has been, it's words can't describe how grateful I am for the City of Lakewood, the Adams Board, the Cleveland Clinic, being able to really come together as a true collaborative effort and come up with a viable solution that really seems to be working.
Thank you so much. Again, I think it speaks to community, which is so important, and I think that's an important message that everybody needs to take away. It's one person helping another, and if you don't speak about it and don't speak to it, you can't access the help. And Derek, could you tell us how Project SOAR is funded?
Excuse me. I was told to make sure I speak up on the mic. Project SOAR is funded through the 21st Century Cures Act. 21st Century Cures Act is through a SAMHSA grant that was signed into legislation by President Obama in 2016 prior to his leaving office. The funding was specifically to battle the opiate epidemic across the country. The funding is slated for 3 different specific purposes. That's peer recovery support programs, medication-assisted treatment programs, as well as quick response teams, in which, as Katie explained, Project SOAR fits 2 of those criteria. So, and they also have the 3 access points in which you could access the program, and that's one being Fire Station 1 as a drop-in center. So people in the community who are in, battling addiction and they want to get help at that point in time, they can walk into the Fire Station 1 and receive help at that point. Also, they can receive, one access point is through Cleveland Clinic Emergency Department, where they help revive overdose victims. So if a person is a survivor of an overdose and they'd like to go into treatment at that point, they can have a peer recovery supporter contacted, and that peer recovery supporter would be there within an hour to meet with that person and offer support, and if they're willing to go into treatment, we'll help them access treatment throughout the county. Also, one of the access points is follow-up. So say a person in the emergency department you know, at that point, that's a traumatic event for them, being revived by Narcan, being in the emergency department. At that point, they might not think that treatment is the best option for them right then. But if they think about it later, they have the peer recovery supporter, the EMS and fire and the police department that will follow up with them to check in on them to see how they're doing, you know, after their incident, and also give them those options for treatment. And they'll be left with information at that point, resources, so even if they don't want to go into treatment at that time, they can follow up with Gina and her team, and she can come out and she can, you know, make contact with them, offer them support, and help usher them into treatment at that time. So.
Thank you so much. And again, I think it again speaks to community, that people helping people. And it's so wonderful to know that here in Lakewood, we have 24/7 access through Fire Station 1 and the Lakewood Emergency Department. And I think that's an important message that everybody needs to know, that no matter when you feel that you want to seek recovery, those options are available to you and people are there to help. Thanks so much, Derek. And if we can ask our police department, how does Project SOAR impact you as first responders? Officer Wintrick.
We've always been seen as strictly an enforcement tool by profession. And as one of my colleagues kind of worded it, we've been different city divisions, often seem to be, well, that was traditionally, well, that's their role, kind of fragmented. He worded it best as this is a united front, and we're part of that, not strictly an enforcement or just a first responder emergency role. We want to be seen in the community, and we are, as approachable and part of the solution out there, that you can come to us for help, that we're work not only with the fire department, with Katie, to coordinate things. And we've seen that with neighborhood policing, initially going out as a security function with the SOAR program, but that's not all that we do. We are a liaison with them, and we're trying to change people's view, and a lot of people have seen that, our role, not just going out as a first responder in emergency, but there to help, that we're approachable, and we'll get you that help. We'll coordinate with these other agencies. Enforcement obviously is our prime function, but the core of policing is the well-being of the community, safety and security, and helping those with addictions and their families, and working with them is a big part of what we do, and we want people to realize and see that, and see that.
Thank you. Could you pass the mic to Officer Sambula? And perhaps he can, he's got his own mic. I'll leave it to fire. If you could share with us how this Project SOAR impacts you as the first responder in fire.
Yeah, I think we're so used to responding to the calls on an acute setting to take care of the people medically. And what this did for us was it got us at the table with Katie and with Gina, and it really educated us on the social aspect, the social services side of things, where you kind of educated more of the first responders, not so on the medical treatment side of things, but also on that this is not like a choice. Addiction is an illness, and just like we go out and treat diabetics with low blood sugar, we go out and treat heroin addicts with Narcan. What Project SOAR affords us to do is we can follow up with the police and with Gina and through the United Front that we've created, and we can go out into the community and try and get these people into the treatment that they need. And it kind of gives us that full service, full circle picture of taking care of them in the acute setting, and then letting them, know that we're there to help them in the long term.
Thank you. And Gina, I remember the first time I heard you, you were so inspiring, and to see a young woman like yourself become so active as a peer support person is really inspiring to me. So I just want to acknowledge that. And if you could kind of share what you feel is the value of peer support.
Yeah, of course. So a lot of people know what peer support is, but they might not even realize that they know. Essentially, it's sharing experiences with another person. You see it in cancer survivors or trauma survivors or parents who have lost children. You know, they go to support groups. And, you know, for anybody who is familiar with those at all, the benefits are incredible. And so much so with those struggling with addiction. The shame is so high and the stigma is overwhelming that being able to talk with somebody who's in recovery and, you know, hear them say, I've been there too, my shame is gone, and I'm in recovery now, the effects, the possibilities are endless that could stem from, like, maybe even that one interaction. So I guess the value is exponential, really.
Thank you so much. And Dr. Welsh, what is the benefit of working collaboratively with the community to address addiction?
Well, I think what we can really recognize working together is that this is an all-hands-on-deck issue. I mean, this is truly a public health emergency, the likes of which we've never seen. I've never seen anything like this in my entire career. Wasn't trained for this. When I graduated from medical school in 2000, I really didn't learn anything about addiction. We learned a little bit about how to manage alcohol withdrawal and get those patients admitted, but I didn't know anybody in recovery until I had the opportunity to work with this team to develop Project Soar. And it has completely changed my perspective on how to manage these patients sensitively and appropriately so that they get the best care. The other thing is a public health emergency. We really need to kind of look in terms of what this means to mortality. We look at all the years of the Vietnam War and all the U.S. combat casualties. More people died last year in the United States from overdoses of opiates than in all the years of the Vietnam War. I mean, that's really massive amount of loss, and we're talking about people in their prime of their lives. So not only is this a massive problem, but we all have to work together to get it taken care of, because just a single person can't do it. In fact, referencing what Erin said earlier when she brought in one of her people to come and see us, I was bereft. I didn't know what to do. I know how to resuscitate them and bring them back, but then what do you do next? What's the next step? And I had nothing. I had a list of resources. That's all I had as an emergency physician. And of course I wanted to do more, but I couldn't. And so Project Soar now allows us to give people immediate access to care, exactly where they are at the time that they need it. And it's been a lifesaver for many, many people.
Thank you. So Erin and Gina, could you talk a little bit about how people can access SOAR?
Yeah, absolutely. Derek touched on it a little bit earlier. So if someone overdoses in the city of Lakewood, they're taken to the Lakewood Emergency Department, and we are called and we respond within an hour. The second access point is Lakewood's Fire Station 1. It's on the corner of Madison and Warren. And at any time, anybody can walk in and say, I would like to be connected to peer support. I would like treatment. The wording is optional, just expressing the idea. And same deal, we are called. We'll respond within an hour and get them into a facility as immediately as we can. The third access point is the home visit. And so every Wednesday, myself, 2 officers and a fire EMS personnel will go to the homes of those Lakewood residents who have overdosed, who we have not connected with yet. So, like Derek said, maybe they were in the emergency department and they said, I don't need treatment. Well, we're going to go and make sure they haven't changed their mind. And we're going to stop by their house, and if they don't answer, we're going to leave a packet, and then provided they leave a phone number, which normally they do, I'm also going to follow them up with a phone call. And that's just to try to make sure that nobody slips through the cracks. We want to give everybody their opportunity.
Thank you. And can you speak to that a little bit too, Erin?
I think Gina pretty much covered all of the points, but the one thing that is so vital with this particular program is the peer support aspect and the support of the city, fire, and police, excuse me, as well as Health and Human Services, being able to really have that collaborative effort, and the hospital's entire staff being able to all be supportive. We're not running into people being dismissive or not telling victims that this is a possibility. We're really seeing everybody on board promoting people getting well.
And if I can just add one thing too, one of the questions we get asked a lot is this only for Lakewood residents? And when we set out with Project Soar, this was a true pilot program. We weren't sure how this was gonna go. This was us all kind of this united front of kind of being innovative and trying something new. And so obviously not all people who overdose in Lakewood are Lakewood residents. So when they're taken to the emergency room, if they don't need to be transferred to an ICU setting, they're treated no matter what, and therefore they have that equal access to peer support through Project Soar. Obviously the same if you're walking down the street in Lakewood, you're not necessarily a Lakewood resident. We try to provide, we're very grateful for this collaboration with the Adams Board to be able to provide that immediate linkage to treatment or recovery support, whatever that may look like for the individual. We're very fortunate to have so many partnerships, and that's one of the huge strengths that the city of Lakewood has, is being conveners and collaborators, and that we have partners with so many of the folks who are in the resource room today, but beyond that through the Cuyahoga County Opiate Task Force, through the Recovering Housing Network, knowing that when any resident or any individual calls the SOAR number, calls me, comes to anybody looking for help, that we're able to really listen and provide a solution, whether that's treatment here in Cuyahoga County or another county or even out of state. We're so grateful to have so many incredible partners and a lot of really incredible energy in this county to come together and face addiction.
Thanks, Katie. Well, if we could just ask one more question that perhaps all of you on the panel could discuss or comment on. From your perspective and involvement in these community efforts, what is one thing you hope people take away from today? Erin, if you want to start.
I think that the biggest takeaway would be that there is hope, that there are solutions, and recovery is possible.
Yeah, anytime anyone asks me what my takeaway is or what my one piece of advice would be is addiction is not a moral failing, it's a disease, and we are not going to get out of it by shaming people. We're going to get out of it by doing the actions that, the City of Lakewood and Fire EMS and police, the Woodrow Project, the Adams Board, community action and positive action, and that's how we're going to see our way out of it.
Just for those families, I want them to lose that kind of feeling or the stigma that if they outreach to us that they're risking somebody getting arrested, family member. We're going to work with you. That's not our ultimate goal, is to arrest anyone. So we just want to be seen as approachable and part of the solution to this epidemic.
I think I would echo everybody's sentiment as a takeaway. We try and get rid of the stigma that's associated with addiction, and that at least for the city of Lakewood, the resources are there and the help is available. So the biggest takeaway is if you want help, we're here to offer it.
I think the biggest thing that I train my residents, my students, and my colleagues, so many people say, well, with opiate addiction, recovery just isn't possible. Everybody goes back to using. And what I try to tell them is, you only fail if you don't try to help. If they don't try to get into treatment, that's really the only failure. And so we're really glad that we have the opportunity now to give people some options for treatment.
I think it can be really overwhelming to sit here. We've done this 3 years now, and even just to sit here tonight and think about the complexity of addiction and the overwhelming surge of a national epidemic. And it can oftentimes feel paralyzing, and I think that all of us can walk away doing one thing today, and that's really being conscientious about our language, and starting to shift from using words that are based in fear and stigma, like addict, or junkie or things like that, using person-centered language. We've seen an incredible shift just within the last year of talking about our language and how we can make it person-centered, as well as our images. You won't see needles or people in pill bottles or scary dark images. You're going to see hope-filled recovery as possible is infused into all of our imagery, branding, and messages, because fear and stigma is all entrenched in shame and guilt, and that just creates brick after brick of a wall that prevents people from accessing recovery. So I think we can all walk away trying to be more mindful of our language and starting to create a shift.
I would say that this disease is indiscriminate. It knows no boundaries, no social constructs. So it affects everybody. It's a humanistic problem. So what's demonstrated today is we have to come together as a community, as an entire county, as an entire state, entire nation, to be able to affect this issue. So that's one thing that I would say.
Great, thank you. I think what I take away from it is that I'm sure that people who have this disease feel very isolated, and the more we can talk about it at the dinner table and at family picnics and family gatherings, the less isolated people will feel, and the more opportunity they'll have to talk about their addiction with others that may offer some help. So I want to thank all of the panelists for participating tonight. Thanks for sharing. And thank you, Pastor Laura, for opening up your church again to this great community support. Lakewood United Methodist Church does so many wonderful things. I think they have meetings here, many meetings every day of the week. So we're very lucky. But we'll get on with our program now, and we're going to have first responders recognition, right, Katie? So all present on stage, and some additional people will be recognized. So who do I turn this over to, Katie? Is this, oh, who? Hey, good. And I'm Cindy.
Hi, Scott.
Hi, Scott. Yes. So I'll turn it over to you.
All right, thank you very much. Good evening, everybody. How are you? Good. I want to thank the panelists again. Personally, I think they did a wonderful job. My name is Scott Wosicki, and I'm the Chief Executive Officer of the Adams Board of Cuyahoga County. So I'm very pleased that Derek was up here today representing us. Thank you, Derek. And I also want to thank everybody for allowing the Adams Board to join this event as part of Bringing Help, Bringing Hope, First Responder Appreciation Week. In Cuyahoga County, our community is joined together to focus on the needs of each and every individual living with addictions and/or mental illness. By focusing on the recovery system of care, we are helping to provide treatment and hopefully long-term recovery to everyone living with active addiction and their families. Bringing Help, Bringing Hope is a statewide celebration that was designed to recognize all working on the front lines of the opiate crisis. Project Soar is just a perfect example of a community coming together to help individuals find treatment and recovery when ready. Project Soar's partnership between police, fire, EMS, emergency room doctors, nurses, and personnel, and peer support recovery coaches is exactly the integrated approach to helping individuals that is needed to address the opiate epidemic. To everyone in this room, whether you are on the front line, a family member, a person living in recovery, or living with active substance abuse disorder, we're here for you. The community's here for you. That's what we heard tonight. We will not give up hope, and we don't want anyone else to give up hope as well. The programs the board funds are designed to bring help and hope. We are proud to support Project Soar and would like to honor all those working for a single purpose, to save lives and connect people to treatment and recovery services. I know it was Aaron, I think it was said, right, that addiction is an illness, right? which it is just like mental illness is also. It's a disorder of the brain. And we have to get people to realize that. It's just like cancer or heart disease. It's something that you have to live with. It's a problem with one's brain chemistry. So at this time, I'd like to have everyone here, as well as other folks who are working on the front line, if you're here, if you could please come up to the stage so you could be recognized. Anyone else here? Okay, here they come. Here they come. So it's Gina, Aaron, Tony, Katie, Shannon, Dr. Welsh, members from the Cleveland Clinic Foundation, Lakewood Emergency Room, and Lakewood Police and Fire. So we would like, on behalf of the Adams Board, we'd like to thank everyone for all that you do and for all the lives that you save. We wish we had something really exciting to give you, but we kind of do. We have a water bottle, and it's filled with various things that represent, do you have it there? There you go. It's a thank you. It's a small token of our appreciation. We wish we could give you all $1 million, but of course we can't. So there are lifesavers in this, because each and every one of you are a lifesaver. There's a Take 5 and a Kit Kat bar, because we know that you need a break. And there's $100,000 and a payday bar in there, because it's not about the money. So we just want everybody to give a round of applause to everybody on the front line, and thank you all for all that you do. We got everybody? Thank you, yes. All right, thank you. You could all go back to your seats now, and are we doing the video? Yep. Yeah, okay. And also, part of the appreciation is that we would like to show you a thank you video from the people across the state of Ohio who've been revived by naloxone and are now living in recovery with their family members.
Being one of those people that says 2 times and you're done, 2 strikes and you're out, it doesn't make sense. So thank you for not giving up on the people that are still struggling to get in the rooms and get the help that they need.
I'm here to raise my children. I'm here to be present and to show up for my family. I was given an opportunity because of the administering of Narcan, and for that I'll be forever grateful. Thank you.
Yeah, I couldn't say thank you enough for that, because it's given me some very important people in my life today, and they wouldn't be here had it not been for that Narcan and those first responders being there for them.
Thank you for doing that for me and not giving up on me and just pushing your hardest to get me back to life and forcing me to go to the hospital to make sure that I was okay.
Thank you for saving me, and I was able to save my baby sister. Thank you. I love you guys.
If it wasn't for Narcan and the first responders, someone who I love very much wouldn't be here today. And for that, I say thank you.
My father has a daughter. My sister has a sister. Because of that, I wouldn't be here. And I'm extremely, extremely grateful for what they do.
I thank you. My children thank you. Someday my grandchildren will want to thank you.
In the last probably 90 days plus, my son's been saved by first responders 2 times. If it wasn't for those first responders, my son wouldn't be here today, and I can't thank them enough.
I've not only been saved once, I've been saved twice from Narcan, and that's not including the times that I wasn't called for overdosing. You know, I'm a miracle to be here. You guys are a miracle by God for saving people you save. And if it wasn't for you guys, I wouldn't be here, and I don't want to be a memory to my children like their father who died will be here next month. So if it wasn't for you guys, I wouldn't be here, because he's not here, and I don't want my kids not to have either parent. You guys gave me another chance to be a mother and be here for my children because their dad's died.
I understand what a difficult job you have. No one ever wants to see a young person die, and we're losing too many too quickly. But I can't thank you enough for what you do. You are there as quickly as possible and do your best job. And the support you give a family when the case always doesn't come out the positive way we want it has been tremendous, and I appreciated that to no end.
Man, I would thank him. I wouldn't even know how to thank him. I mean, because they saved my life. Even now, I mean, I'm still fighting for my life, you know what I mean? I really am, and that's something that I won't ever forget.
And thank you to all my brothers and sisters out there in the fire service as first responders, saving lives. How fortunate we are to have had that opportunity, and thank you for all that you do.
Just don't stop. Keep going and keep doing it. You never know, like, whose life that you're going to impact by hitting with Narcan and what you can, the opportunity that you can end up giving somebody. So no matter how many times, myself, I did like 7 to 8 times. And I kept getting hit with Narcan. And I'm here today, with a good life. So just don't stop, don't give up, never lose hope.
You've just seen the many voices of gratitude to thank you for the work you do. On behalf of the Ohio Association of County Behavioral Health Authorities, we too would like to thank you.
If you go to the Ohio Association of County Behavioral Health's website, they have all sorts of other videos up there, and I hear that today there was just added one from Henry Winkler, the Fonz, so he's something. I haven't had a chance to see it yet, but if it's the Fonz, it probably has to be good. Okay, so then would also like to present, I think, to Katie then, I will do that, or yes. It is a proclamation from the governor proclaiming the week as Responder Appreciation Week. So we have that for you there. Okay. Oops. Oh, there's another one. And then we'll give this one to Aaron, that this is from Ohio Attorney General Mike DeWine, who is a proclamation for the week as well. So we want you to have that. Okay. And I just want to leave you with the message of, thanks everybody for not giving up. We really appreciate you more than we could really ever show. And then just also like to echo that treatment works and people recover. So thank you very much.
Okay, so let me just inform you again that the resource room will open again at 8 o'clock. And that's in about 10 minutes. And the Naloxone training will be right here on the stage, and it's free. So everyone here, I hope, I haven't been trained. I'm going to get trained, but I think everybody should be trained. We all need to know that. And Tony Gelsomino will be back in the chapel reading room for the family support conversation. I want to thank you all for coming tonight, and we're so lucky to live in a community like Lakewood who is so responsive to the needs of the people in the community. And I think what's real important too is that we as the message was stated, we don't want to stigmatize people with addiction. We want to open our hearts and open our arms and have conversations about just like we would if somebody had cancer. Thank God for hospice. Hospice is there to support people with cancer, and not only the patient, but the families, and often it's the families who don't know where to go for help. But I think that you can see from the resources we have here on stage, if you are a family member who feels hopeless, that you don't know where to go, there's plenty of people here that can offer that support to you and kind of point you in the direction that's needed. And I just want to emphasize again that this is such an epidemic. I heard on NPR, a small town in West Virginia, 90% of the babies that were born addicted. 90%. So it's not only the people that are living, but it's the people that are coming into the world that are facing this problem, and they're innocent. But I think we can do a lot as a community and as human beings to reach out to others who just might need some support. And I just think it's phenomenal that we have recovery houses here in Lakewood. I'm so proud of the community and the hard work that Aaron has done to make that possible too. So thank you all for coming, and Hope to see you up on the stage and back in the resource room and in family conversation. Thank you all again for coming.